is SCIVU, Special Baby Care Unit, where we admit babies from 0 to 28 days. Not all babies. Those babies that are within the range of 0 to 28 days that have issue. Maybe they have neonatal jaundice or asphyxia or low birth weight or premature babies or any condition that associated with babies by 0 to 28 days. Once after 28 days, do not admit again. By suffering from asphyxia, that is inability of the baby to cry after birth, or the oxygen cannot saturate to the brain after birth. Then this asphyxia, most time we have mild asphyxia, we have moderate asphyxia, we have severe asphyxia. Like baby Chukwuemeka now is suffering from moderate asphyxia. Then this asphyxia, we have a lot of causes. What can cause this asphyxia? Prolonged labor can cause asphyxia. There is the labor that lasts more than 18 hours. We have low birth weight. It can lead to asphyxia. We have prematurity. Those premature babies that have not reached 9 months, that is 40 weeks, they can have asphyxia as well. Then aspiration can cause asphyxia. If the baby is eating and the baby will vomit, all those things will come out from the mouth and the nose. It can cause asphyxia. Then, poor maternal effort during delivery. There is inability of the mothers to push baby. It can cause asphyxia because as the baby is inside the uterus or perineum, they will be aspirating those meconium. Thereby, when the baby is delivered, they cannot be able to cry, and oxygen cannot be able to circulate to the brain. It can cause asphyxia. Then this asphyxia is very dangerous, as you can. It's not ordinary sickness. It's a very big challenge to babies and the mothers, even to the nurses, because if the baby have asphyxia, if immediate attention is not given to the baby, they will die, or can lead to serious complications that will damage the baby for life. For example, once the baby have asphyxia, they will have seizure. That's number one thing. Even if they do not have seizure at that time, maybe in the next 24 or 48 hours, they will start having seizure. As they're having that seizure, it will be affecting brain small. Then, the baby that have asphyxia, you don't need to start feeding the baby immediately. You just wait for like 24 hours or 10 hours to feed the baby. And you will not feed the baby through the mouth. Because if you feed the baby through the mouth, the baby will aspirate and the condition will worsen. And this asphyxia, some mothers will feel like, my baby has started crying, my baby is saturating well, and my baby is not in oxygen. Leave it, nothing is happening to my baby, which is very bad, because nothing will happen to that baby at that time as you're seeing the baby. Later in life, maybe in adult phase, you notice that the baby is not coordinating well, the cognitive mechanism, everything is not okay. Even in class, you notice that the baby will not coordinate, will not organize him or herself very well. So all these things is effect of asphyxia. Some of them will be hyperactive, some of them will be low in everything, they'll be so dull in everything they are doing. All these things is effect of asphyxia. Poor maternal effort. You tell the woman to push, she will tell you that she's very weak, she cannot push, and the baby is at the baby's head is at the perineum. The baby will be there aspirating those meconium. And once the baby is delivered, you notice that the baby cannot cry. The baby is desaturating. It can lead to asphyxia. So once you see that the woman cannot push, call the gynecologist to section the woman and bring the baby out. Another thing that can cause asphyxia is prematurity. Those babies delivered at 7 months, you can have asphyxia because one, their lungs is not yet mature. This asphyxia can be prevented. It's not as if it cannot be. It can be prevented, one, by good antenatal care. Once you come to antenatal, as they said, and notice that your BP is very high, pregnancy induced, or you're having pregnancy induced hypertension, preeclampsia, because preeclampsia can lead to asphyxia. But then you are having that, you need to have cesarean section. Once it's reached 9 months, you need to have section you so that your baby will be very sound. Another thing that can help us to prevent asphyxia is avoid prolonged labor. Another one is to avoid prolonged pushing. Once you push 2 or 4 times, stop, go and section your baby and bring the baby and have a sound baby.